Hey everybody, Happy New Year. It's Barbara Cape, President of SEIU-West. I hope you all had a chance to have a bit of a break over the holidays and a chance to recharge your batteries, because I think we're going to need it. So SEIU-West is going to be focusing on your mental health and wellness for the next year. And I had an opportunity to attend the nursing care conference with our members who work as continuing care aides, direct support workers, licensed practical nurses. And, there was a great mental health check-in with the attendees of that conference. And, like you guys know this, people are hurting. They are psychologically and emotionally just screwed because of the last 2 years. So, and my heart is breaking. It's a bit of a gut punch, quite frankly, because I know this is happening, but listening to people who are just crying because of just the impact of the last 2 years. And really, it's a bit of a culmination, a peak that we've been driving towards, because we know that short staffing not only affects your physical, but your mental and emotional health. You're exhausted. And this pandemic hasn't seen any improvements when it comes to that. So this is why we want to focus on mental health and start really building capacity for our members, because you get information from your employers in a bit of a fire hose fashion, a flood of information, and you just can't take it in. So I'm hoping by talking about this, member to member, that we can start accessing some of those resources and supports. And I'm not giving you a therapy session, because I'm not a therapist. I'm a cook, and I'm the president of a union. I don't have those skills, but I want to make sure that you have access to those supports and those resources. And maybe if you're not feeling, exhausted or frustrated or pissed off, maybe you know someone who is, and you can give them access to this information as well. So today we're starting with the supports available to our members in the Saskatchewan Health Authority in the larger healthcare sector. And many of our members who work in that sector should have access to these supports through their My Connection access at the workplace. Now, if you're rolling with the changes and you aren't feeling the need to access these services, good for you. Absolutely awesome. I don't know what tools you're using, but it'd be great to share those so that we can all sort of roll with them. But if you're feeling irritable, overwhelmed, pissed off and anxious, and feel like you aren't your best at home or at work, this is for you. So we've had some conversations with the SHA and talked about, what is out there for healthcare workers to access. And so through My Connections, there's a website link to the Resilient Workplace. And some people, when they access supports or mental health supports and resources, they want to do it on their own terms. And so they want, there's documents, there's webinars, there's videos that can give you, tools and tips for managing mental health stressors. So you can find that on your My Connection site with SHA. There's something as well called LifeSpeak, and I'm not quite sure, I haven't dug into it yet, but LifeSpeak is digital education with videos, podcasts, and tip sheets, kind of like the Resilient Workplace website, that can maximize your mental health and well-being. Now, there's workplace strategies for mental health through Canada Life, which is our benefit provider. And you can find a link to that on the My Connection. But we'll also set this up on our website so that you can connect through our website. And if you call the Member Resource Center, they'll be able to direct you where you need to go for those resources as well. Now, there's the mental health support line for healthcare workers that has been set up. And that number is 1-833 233-3314. And you'll get connected with a trained mental health professional for support, resources, and if necessary, a bit of an intervention. And, this is just one option for when you're feeling like, oh my God, this is too much. Call this phone number. This is in-house within SHA, and it provides you with a quick and easy contact so that you can reach out and have a conversation. I think it's important for us to access that phone line because it's free, it's available, and it's an immediate assistance for if you're feeling overwhelmed or if you are feeling like your mental health is just bruised. The other resource we have is employee and family assistance. And this is done through Morneau Chappelle. Now, it's a bit, quite frankly, I mean, there's good things said about EFAP and there's crappy things said about EFAP. And if you're having a bad experience with EFAP, we need to know this so we can follow up and get it corrected. But employee family assistance is covered under our collective agreement. It can be used in tandem with other supports, so it's not like one or the other. But there's virtual counseling, there's supports and services that they can provide to you. So you can contact the Member Resource Center who can direct you, or, and this is a 24/7 support line. You can call 1-844-336-3136. And that's a 24-hour support line. And then obviously our benefit plan through 3S Health, there is $2,000 per calendar year covered for clinical psychologists and social workers support. And so you can connect with 3S Health through our website, or you can go to the 3shealth.ca website and access those supports. I think it's important for us to acknowledge that it's okay for us to say when we're not okay. There are some days where I'm not okay and I need to step away from any media and just read a book or go and work out just to get my head out of the current situation with the COVID-19 pandemic. And sometimes you can talk to a friend, but sometimes that isn't enough. And you need to talk to someone who's got a bit more background and skill in providing those sorts of mental health and wellness resources. You guys got to remember, even in a battle, soldiers get respite. They bring in relief troops, and that's not what's happening right now in the healthcare system. So if you need that respite, if you need that relief, these resources are one way to get some support and some relief in order for you to sort of find that balance back in your life. So next week, we're going to talk about some more supports that are out there for our members who work in other workplaces, like extended care, like the community-based organization sector, like the education sector. These are pretty challenging times. And I think all of us thought that this would be over. I absolutely thought that this would be over within 3 months back in 2020. But here we are in 2022, and we're still slogging through the deep snow of a pandemic. So I want to make sure that rather than us turning on each other with our frustration and our anger, that we're accessing supports so that we can find a way to manage our mental health and get an intervention if it's necessary. So I strongly encourage you to access these supports. You will be posting them on our website. You can also find them on your My Connection if you work for SHA. And if you have a need for any other supports, contact our Member Resource Center and we'll see what we can do to help you find those supports. Take care of yourselves, everybody. Don't take your mental health for granted.